Today, I am going to talk about something that is affecting millions of women around the world, but many people still hesitate to talk about it openly, and that is infertility. Specifically, infertility in women between the ages of 17 to 45. A lot of women try for months or even years to conceive, and when it does not happen, they feel stressed, confused, and sometimes even blame themselves. But the truth is, infertility is usually caused by underlying medical or lifestyle issues, and today I'm going to explain the 10 most common reasons why a woman might face infertility. If you or someone you care about is going through this, listen closely because awareness is the first step towards finding help and healing. I am Kazim, final year med student, and love to share knowledge related to health, fitness, and much more. The first major cause is polycystic ovary syndrome, also known as PCOS. This is a hormonal disorder that affects how the ovaries work. It can lead to irregular menstrual cycles, delayed or absent ovulation, and it also causes a hormonal imbalance that make it harder for a woman to release an egg each month. Even if she is getting her periods, she might not be ovulating regularly, which directly impacts her chances of getting pregnant. PCOS is extremely common in young women and often goes undiagnosed for years. Another common cause is endometriosis. This condition causes the tissue that normally lines the inside of the uterus to grow outside of it, usually around the ovaries, fallopian tubes, and pelvic lining. This abnormal growth leads to inflammation, pain, and the formation of scar tissue. These changes can make it very difficult for the egg and sperm to meet, and even if fertilization happens, it can prevent the embryo from implanting properly in the uterus. The next reason is hormonal imbalance. A woman's reproductive system depends on a perfect balance of hormones like FSH, LH, estrogen, progesterone, and even thyroid hormone. If any of these are too high or too low, the body might not release an egg at the right time or at all. For example, women with hypothyroidism or high prolactin levels often face difficulties with ovulation. Without ovulation, pregnancy simply cannot happen. Age is another major factor, even though many women do not think it affects fertility until much later. In reality, fertility begins to decline slowly after the age of 30 and more rapidly after 35. The number and quality of eggs reduce with age, and older eggs are also more likely to have genetic issues, which not only makes it harder to conceive but also increases the risk of miscarriage. Blocked or damaged fallopian tubes are another very common cause. These tubes are essential for transporting the egg from the ovary to the uterus. If there is any blockage or scarring, the egg and sperm cannot meet. In many cases, these blockages are caused by past infections like pelvic inflammatory disease, or by surgeries, or untreated sexually transmitted infections like chlamydia and gonorrhea, which can silently damage the reproductive organs over time. Then there are uterine problems. If a woman has fibroids, polyps, or an abnormally shaped uterus, it can interfere with implantation or cause early miscarriage. These structural issues might not affect her overall health but can still play a huge role in fertility. Some women are born with these abnormalities, while others develop them later in life without even knowing it. Lifestyle plays a huge role too. Many people don't realize how much things like being overweight, underweight, smoking, excessive alcohol use, drug use, or even extreme dieting and over exercising can impact fertility. The body needs to feel safe and balanced to support reproduction, and when it's under too much physical stress or lacking key nutrients, it might shut down ovulation as a way to protect itself. Stress is also a silent contributor. Chronic emotional stress affects the brain signal to the reproductive organs. It can throw off hormone levels and delay or prevent ovulation. Many women with high stress levels, anxiety or depression may have irregular cycles without even realizing that stress is behind it. Another overlooked factor is undiagnosed or untreated sexually transmitted infections. STIs like chlamydia and gonorrhea often have no symptoms, but if left untreated, they can cause permanent damage to the reproductive system. They can scar the fallopian tubes, cause infections in the uterus or ovaries, and create complications that make conception extremely difficult. And finally, we have what's known as unexplained infertility. This is when doctors run all the tests and everything seems normal, but the woman still cannot conceive. This can be extremely frustrating because there's no clear reason or target for treatment. Around 10 to 20% of infertility cases fall into this category. And while it is called unexplained, it does not mean there is no solution. It just means that the current tests could not identify the problem and more detailed investigation might be needed. So, if you are someone who is trying to conceive and facing difficulties, remember that you are not alone. And most of these causes are treatable. The most important thing is to seek help early, talk to a doctor, and don't let the shame or fear stop you from taking action. Infertility is a medical condition like any other, and the more we talk about it, the more women will feel supported, empowered, and ready to take control of their reproductive health. If you found this video helpful, make sure to like, share, and subscribe for more informative content about women's health. Thank you so much for watching and take care of yourself.